So today in rounds, we talked about lumbar spinal stenosis. So how would you describe that problem to a patient?
A lot of times it's the conversation of the space around the nerves in your spine is just too narrow. There's normally lots of space. The nerves are happy. They're floating in there. And over time, you can develop changes in the spine that then make that space too small. And so now they're all crammed together, and there's just not enough of the blood supply getting to those nerves, and you start to feel it in your back and legs, especially when you're walking and standing. That's usually how that initial conversation goes.
Okay.
Yeah.
What do you think? How do you describe it to people?
I always say it's a space issue.
Mm-hmm.
You know, whether it could just be either arthritis or maybe there's something happening inside. But again, it's just those nerves get constricted. And I always say that anytime the nerves get constricted, it's sort of like a dimmer switch. It just sort of turns down the power. And so all of a sudden, you're not getting as much message down to the muscles in the lower extremity.
Okay, so what symptoms? So patient has lumbar spinal stenosis. What would be the typical symptoms that they would come in with?
So I'll jump in with this. I always I joke about this thing called the Costco functional walking index, which is not a thing, but how far can you walk in a Costco before you feel like you need to sit down, or you feel like you need to lean on the cart?
Yeah.
Like, can you make it from the parking lot? Can you make it over to TVs or whatever that is? And so it really, the symptoms are just as I start to walk more, I start to feel more fatigued than I would previously, and I'm starting to look for places to rest or sit down or maybe lean on a shopping cart.
That's a great way to say it.
I agree. I think that's a perfect example of how far do you get in the grocery store or Costco. Sometimes the hard part is, like was mentioned in our conversation, they don't always describe it as pain. It's more of I feel weakness or I feel fatigue, and I just have to rest. And then it's sometimes teasing out, is it a strength issue? Is it a pain issue? And what is it? But it's not always as simple as my legs hurt, so I have to stop. It may be more of something feels off, and I just have to sit down, and then it feels better, and I keep going.
Okay. I think that's a really good way to put it. Okay, so I'm a patient. I've just been told I have lumbar spinal stenosis, and neurogenic claudication is the technical term of the challenge with walking and needing to sit. What is that? What are the options for treatment? What should I be thinking about?
What I talk to patients about is I lump everything in a category, and I'll defer to you a lot of the expertise on the physical therapy type conservative options. But I lump them into those type of conservative being physical therapy, change in activity levels, then going on to more potentially invasive things like epidural steroid injections, which can improve symptoms, but it doesn't fix any of the problems. But they can provide relief. You can walk further. You can stand longer for 6 to 9 or 3 to 6, sometimes 9 months at a time, to just try and improve functioning, and then going to kind of more invasive options after that. But a lot of times we can start with some of those physical therapy type things.
Yeah, I mean, in the physical therapy world, it's can we restore normal mobility, build strength, and as we mentioned today in rounds, bending over to get anything off the floor is 50% hips, 50% back. And are the hips moving as well as they should be? Do we have the strength? Sometimes it's a strength issue. Their hips aren't very strong, and every time they bend over, they don't feel stable here, so they start using their back a little bit more. Sometimes that can exacerbate different symptoms, or maybe they're just really tight. And so physical therapy is a great starting point. But again, remember that this is a structural issue. Oftentimes, in the absence of all of the things that we can do, sometimes the structure maybe needs to be altered.
And I've always thought that this particular problem was a structural problem, a surgical problem. And the enlightening thing, I think, for me, working with the team, is that it is, as much as it is a structural issue and it is a clear surgical issue, it is a interdisciplinary issue and a clear need for physical therapy, for pain management and chiropractic, because it affects a lot of things. I would say one primary objective in management and treatment is to keep the patient moving, keep the patient walking. if we can keep you walking, then you're going to maintain muscle and bone strength and ligament strength. You're going to have a quality of life. That's really the primary objective. So one scenario would be all of a sudden things are worse, and I love an injection for that, just to cool things off. Reevaluation with physical therapy. What can we do differently to manage this with lifestyle modification, and how can we keep you walking? In the case where patient has spinal stenosis on their MRI, they have symptoms that are consistent with spinal stenosis, and they've been managed and treated with physical therapy, chiropractic pain management, and are still having difficulty walking, can only go for 30, 60 seconds or maybe a few minutes at Costco. Surgery is very effective, and there's lots of surgical options, which I don't think we need to go into, but counseling with your surgeon and with your interventional team at the different options, because there's a lot of nuance to what would be the best for a particular patient. But the main issue is that stenosis has crowded the nerves, and it's like an excavation project. We're just going in and clearing it all out, or in some cases putting something in to hold the spinal canal open to keep the patient functional. Any other comments about spinal stenosis?
I mean, I want to comment just on my experience with just treating patients over the past, 22 years. Like, when it comes to spinal stenosis type surgeries, like, they're generally really effective, and the long-term side effects are really low. And of the types of back surgeries, this is one of those ones that when patients are finally to that point where space issues are the problem, they tend to do really, really well with it. And so it's not one of the ones where we're just like, run away from that type of a surgery. I think these have been very effective for those patients that have, no longer finding the benefit from pain management, chiropractic care, and physical therapy, where it continues to be a problem. And the goal really is, can we get them moving? Can we keep them strong? Can we get them back into the game of life? So.
Mm-hmm. I think a lot of times it comes down to a conversation. It always comes down to a conversation with the patient of, we have these options. We have conservative. We have more aggressive options. How bad is your pain? What have you tried? How much does it limit what you're able to do? And if patients find that it really doesn't limit what they're able to do, then we have a conversation of, well, then let's stay a lot more on this conservative side and try and prevent things from getting worse as much as we can. If it's more, I can't do anything. I can't play with my grandchildren. I can't, go watch my daughter in her dance recital or anything like that, because my pain is so significant and I can't even walk from the car to the auditorium. Well, then it may be a different conversation of, then we should do whatever we can to try and help you retain that ability to do the things you want to be able to do, to live the life that you want to be able to live.
I love that. You're treating the patient. Well, the goal of treatment and management is function, it's quality of life, it's doing the things you want to do, not to make an MRI look better or some other additional objective. So that's a great way to think about this particular problem. And I think all of the stuff that we deal with is, how can we help you continue to have a good quality of life and do the things you want to do.
Yeah,
agree.
Well, thanks for coming in this morning. It's always good to see you guys.
You too.